Welcome. In this demonstration, we're going to walk through an excursive movement and how to identify whether the excursion is exactly what we're looking for in regards to canine guidance. And so if we look at the scan, it's just a general right lateral excursion. You have your A, B, C, and D lines. But when we evaluate an excursion, one thing we want to do is quickly go up to the View menu and click Arch in Quadrants. And what this does is it takes the 2D arch here and it divides it into 4 quadrants. And this will allow us to evaluate the C to D area, which is the movement from maximum intercuspation to anterior guidance. And so when we see this, and we're evaluating just for excursions, we really want to focus in on the C to D, to the point where we can actually click at the C line or hit the C key on your keyboard, and that's where we'll begin our evaluation. There are 2 things to look for. The first thing is the movement of the center of force between C and D should be a sharp, direct movement towards the canine that they're sliding to. So for example, as of right now, between closure and maximum intercuspation, your center of force resides here. We would like to see, as we play the movie, the center of force icon move directly and smoothly to number 6, which would show that the canine is getting guidance with little interferences. So as I play the movie, we'll watch the gray bar in the graph move through, and what we're looking for here is the quick movement. I'll pause it at the D line. So our pattern here is actually a little bit different than what we're looking for. We see it go posterior a little bit and then anteriorly towards the canine. And so this might be a justification that you need to do something to help canine guidance. And so once we know the pattern and we have an idea that there is a challenge here and we want to try to fix it, the next piece is to identify where the challenge is located. And so, with the 4 quadrants, what we look for is the blue and the yellow. Immediately after the gray bar passes the C line, those lines should go to 0. And we can see that the left posterior does look like it gets to 0 pretty quickly right about here. There are some light forces, and it kind of just stays low for the rest of the excursive movement between C and D. Now, the posterior right is a different story. It actually increases. You can see the line go up, flatten, and then start to go down slowly. And so this implies that there's some posterior interference. And that is probably directly related to this red line. Instead of going smoothly to 6, it kind of flattens out. And so this flat posterior movement can imply group function. And so as we play through this movie incrementally using the forward 1 frame button, you can see that there are forces here. And actually, if we go back right to where the center of force before it moves towards 6, you can see that tooth number 4 is one of the higher forces that are creating this discrepancy, along with, it looks like, tooth number 3. And so a quick adjustment in these areas may result in a quicker movement. And so when we play this movie a little bit more, the idea would be is that this little corner here that's created could be a smooth transition directly to that if we were to adjust some of these interferences between 1 and 5. Ideally, what we look for is the C to D areas to be pretty close to each other, meaning that the blue line and the yellow line drop directly to 0, and the red line, since it's a right lateral, will go straight to 100%, and the anterior left, or excuse me, that's right, the anterior left would go to 0 also. So you'd have 3 colored lines going to 0 with 1 going to red in a smooth, fast fashion, and the D line would be placed somewhere closer to the C line on the computer. But in this case, you can see the computer placed it all the way out here, which is a significant time discrepancy. And that's for another video. We'll talk about the differences in the C to D times and what that means for the patient. If you have any additional questions, you can contact Tekscan, or you can go to our online website and look for additional resources, and our videos are available. Thank you and have a good day. So hopefully this video gave you some indication of how you can use the Tekscan graph to help identify muscle strength issues and possibly lead to better questions for your patients in the future. If you have any additional questions, you can contact Tekscan, or you can go to our online website and look for additional resources, and our videos are available. Thank you and have a good day.